The crappy thing is that because of COVID, they're not allowing visitors. Sorry, my eyes are watering. They're not allowing visitors, and so I'll be in the hospital by myself. And then Crystal will fly in Thursday and pick me up Friday. So it's going to be a long 5 days. Hopefully I sleep most of it. I think it'll be longer for her, actually, than for me. But so you get picked up, and they send you home, or wherever you're staying, with the wound vac still on your arm. So wound vac is some type of equipment that they put over where they took the graft. And they do use the Integra on your arm. And then they put your split thickness skin graft on it, and then they put this wound vac on to help everything like vacuum seal and heal. So you go home with that on Friday, and then they take that off. So you have follow-up appointments every Wednesday for 3 Wednesdays, and they take that off the first follow-up appointment, and then you start changing the dressings. The other thing we talked about was insurance a little bit. So they say, they need like a 3-month lead time to get all your pre-approvals for insurance. So starting, I think, November 8th will obviously be 90 days until surgery, and then at some point thereafter they'll start the pre-approval process, which I hope goes well. Then we talked about the letters that you need, which I've already gotten in. And we talked about how many phalloplasties Dr. Santucci's done. I think what these notes mean is that the clinic does 140 a year. He does about 40 a year. And the ones he's done have been like 50-50 between RFF and ALT. That's what that meant. He doesn't have a lot of pictures of his work on the site. But honestly, I decided I'm okay with that. All the penises look different, but the same. They all turn out a little different, but you basically have a good idea of what you're going to get. And I'm cool with that. So then we talked about... Sorry, I'm trying to rush this now because I'm at 21 minutes in. But if you're interested, you're interested. So then we talked about the nerves. And, how they sew... specifically, I'm interested in the erotic sensation. Obviously, I want tactile sensation too, but I was like, what is the percentage that I will gain erotic sensation in my penis afterward? So his percentages were that 80% of patients get like full sensation, erotic and touch sensation. He said about 15% of patients only get like the touch sensation, and 5% of patients get no sensation. So that's those numbers are definitely higher than I am comfortable with. Thinking about 5 out of 100 surgeries not getting any sensation in their penis is terrifying. And you just have to like go into surgery and hope that you're one of the 95% hope that you're one of the 80% who gets full sensation, or at least some sensation. It is it's upsetting to think about. There's a chance that you go into this and come out with a penis that you can't feel. And I believe you can still, orgasm with your old junk that is inside of your new penis. But I really obviously want to feel the whole thing. So I hope that turns out well. And if it doesn't, that's something I'll have to deal with when the time comes. Then we talked about other complications. 1%, he said, have a serious vessel problem, which is where the blood is either not flowing into the penis or not flowing out of the penis, and then they have to perform some magic to try to fix that. Out of all their phalloplasties, so far they've had one person who lost the whole phallus, which, obviously I feel heartbroken for them. And they've had many who, lost portions of the phallus due to blood vessel problems. Well, not many, but anyone I think is too many. But that's part of surgery. And this is a very complicated surgery. And that's something that we all need to be real about and have realistic expectations, I guess. Then we talked a little bit how they monitor your phallus right after the surgery, very closely, obviously, to try to avoid any serious vessel problems. And then we talked about the urethra. And if you don't have urethral lengthening, obviously there's no issues. But if you do choose to have that, which I am, he said about 40% of patients, something goes wrong. It's very high, so be prepared. He said about 20% get a fistula, which is easy to fix, he said. And, of course he's a urologist, so easy to him is probably maybe not easy to us who are dealing with it, but... And then he said, I don't have a percentage here, but then also a percentage get a stricture, which could happen, 3 to 4 months even after surgery, that you could get a stricture. So that's the end of her notes. At that time, we just had to get our letters in and then get scheduled, so I did that. And now I'm scheduled. I won't... I want to make another video about how I'm at as far as preparations, how I'm feeling, and all that. But since this was already so long, I'm just going to cut it off on the consultation. So that was my consultation with Dr. Richard Santucci at the Crane Center. I liked him. I thought he was, I thought he steered the conversation well, in that, he had the things that he wanted to say, but then he also, or needed to say, but he also allowed me time for questions. I didn't feel rushed. And I felt that he was positive. He seems like a very positive, optimistic person. But also realistic that, this is a very complicated surgery and the outcomes aren't always predictable. And just be prepared for that. But he did say that, most things, although they seem, especially talking about urethral issues, although they seem very big at the time, and they're obviously a huge pain in the ass, they're fixable. So I guess you have to think long term. But yeah, I liked him. I feel comfortable with him. And, yeah. So that's it, guys. Thanks for watching. This probably the longest video of my YouTube career. Talk to you later.